Hello and thanks for joining us on Relational Practice, a social work podcast. I'm Dr. Jodie Park.
I'm Rose Mackey, and we're both private practice social workers here in New South Wales, Australia, working in the fields of child protection, out-of-home care and trauma. And today we're on Darawal land. Got somewhere to be, Jodie?
No, I'm sorry. My watch just keeps going on. We've only just started.
Righto.
All right. Okay, we're back. You ready? We would love you to follow our podcast and connect with us on Facebook, Instagram, and via our new YouTube page. Do you know, Rose, I actually made an Instagram account yesterday.
I'm so excited.
I obviously have no,
Can I be a friend? I have so many reels to send you.
Yes, because I don't know how to actually use Instagram, so I'd love you to be my friend.
Welcome to Instagram. Anyone out there listening? Find Dr. Jodie Park on Instagram and bug her.
I just wanted to see what you post about our podcast.
Oh, did you?
No, I mean, not that I'll watch any of it, but I just want to see it.
Hilarious.
I know.
So it's been very quiet the last fortnight on social media for us, and that is my bad. I'm very sorry. I've been very busy, but I will jump back in.
I mean, to be fair, it's been school holidays. You've had to get kids back to school. We've had Christmas. We've both been sick.
Yes, there's been a lot going on, but that's life. But yeah, I have dropped the ball, so I'll pick it back up tomorrow. Got an assessment due this afternoon, and then I'll be back on.
All right. Okay. All right. So please, yes, follow our podcast and connect with us on Facebook, Instagram, and YouTube, as I said before. And please send us any practice stories, questions, comments, emails, anything really, to relationalpractice01@gmail.com.
Yeah, that would be great.
All right. Today we're going to talk about birth-family contact, which we've been wanting to talk about for a while.
I mean, to be fair, we talk about it often in the office and between ourselves, and
That's
it's a
Yeah.
bit of a multifaceted, interesting passion topic, I would say.
Yeah, I agree. It's definitely a passion topic. We want to really focus on the role of supervision of the contact experience. That's kind of what we talk about a lot, that and planning.
Yes, and the reason why.
Yeah, that's right. It's kind of like thinking about it in terms of thinking about the knowledge that sits behind decision making, but also the knowledge that should inform what happens during that contact experience. So the knowledge the supervisor needs to bring.
I like how you said should.
Oh, well, it's definitely a should.
Yes.
Yeah. We also wanted to talk about this because we had a listener email from Rosalind. Thank you, Rosalind, for your email, which kind of reminded me that we hadn't talked about this yet. So yeah, I'm really glad, Rosalind, that you sent that email in. And Rosalind talked about her experience of working in the child protection system, and she really raised some great points about contact supervision and how workers make an assumption that the child will be safe in contact because there is a supervisor present. And we know that that's an incorrect assumption, but we also know there's a difference between physical safety and emotional psychological safety. And just because a child might be physically safe doesn't mean they're emotionally and psychologically safe.
Was really good points that you raised, Rosalind. So I think sometimes there's an unconsciousness in this field of practice around many things. And I think when we saw that email just in black and white, we were like, great way to articulate what we often talk about.
Yeah. And also, I mean, we love your emails. Please send them in. And it does prompt us to kind of think about different topics that we may have wanted to talk about but forgotten, or things that we haven't actually even thought about talking about.
Yeah, definitely.
Yeah, so send them all in.
We will respond. We're not very timely all the time.
No.
It's a terrible way of speaking, isn't it?
But it's true.
We do endeavour, and we will always get back to you. It just might not be within the first 48 hours of the email hitting the inbox.
Or maybe the first week or 2 weeks sometimes of the email hitting the inbox. But, we will get back to you. All right, let's get into it. You ready?
What is the title of what we're talking about? Is it family time? Is it contact? Is it birth family contact? What is it, Jodie?
I love that you asked that question. I think that the downplaying of birth family contact by calling it family time is absolutely obscene.
Can tell me what the downplaying is. What do you mean?
I think that by calling something family time, it automatically denotes this. Denotes, is that the right word? Yeah.
I like it.
That this would be some kind of amazing experience for all the family members, and that it's just a really nice time to be together and just to kind of, form those bonds. Where we know in reality that's actually not what contact is about, or that is not the experience of contact for all family members.
Yes.
And I think it's one of those things where our statutory child protection system has used the language to
intentionally
to minimize an activity. And I think it's so that there is a lack of importance then placed on that activity in terms of what it means.
Okay.
Do you think that's fair?
I think it's very fair. And I think you obviously thought about it on a much deeper level than I have, because my irritation with calling supervised contact or contact, calling it birth family time, it reminds me of, those influencers that, I don't know, go through and show their morning routines and everything looks beige but pristine and everything is amazing. It's like a fake.
Yeah.
It's fakeness.
It's very fake.
We're calling it something, and it's this aspirational, I don't know, I used to call it the land of unicorns and lollipops and rainbows where nothing bad happens. And it's so unrealistic. And in general life, I don't know many people that talk about their Saturday afternoon as birth family time or scheduling birth family time. Like, it's there's such incongruence anyway. It's just so fake for me. But I do like when you go deeper and say it minimizes the activity. It absolutely does. And the assumption that it is going to be this wonderful event or few hours for everyone is so far from a reality I've ever witnessed in 25 years of practice.
I agree with you. And I think that intentional minimizing of this activity is so dangerous because firstly, it means that I think you don't have to pay people to supervise the correct rate to supervise because it's just seen as just a hanging out experience. And secondly, I think it then has an impact on decision making.
Yes.
Because if this is just an inactivity that's just like this very fun little, get together, then why do you need to put so much time into making a decision about it?
Yes. Because it's not organic and it's not natural and it's not just easy breezy. It's none of those things.
No.
But that's the connotation, isn't it?
Yeah.
Because you're right, we won't pay a supervisor. We'll get someone else in the birth family to supervise it, or the carer.
That's right.
Or the child's now 13. They'll be fine in the mall, walking around the mall for a few hours with their biological father.
I mean, all the child's now like 6. They can keep themselves safe, surely, Rose. Physically and emotionally safe. Well, I don't even think there's a in some situations that I'm aware of, there's not even a consideration about the different types of safety. It's all about physical safety.
And when often too reviewing what, I call it contact, reviewing what the contact looks like.
Yeah.
Tick box. Frequency, duration.
Yeah.
Child went home.
Yeah.
And their session ended and there were no drastic adverse events. Tick box. Contact's going really well.
Yeah.
Yeah. So what do you call it?
I call it birth family contact. I refuse to call it anything other than that because that is what it is. And I think I would rather not do any work at all if I had to call something family time because I just think that is just so demeaning in terms of what it actually is.
It's like your way of silent protesting.
Yeah. And I'm not a good silent protester.
No.
I mean,
no, you're not.
No, I can't be.
No. So what is the goal of birth family contact? Oftentimes I think when children enter care, the goal is to maintain a connection with birth family. And sometimes I think we don't often go deeper than that. We just want to maintain a connection, which is lovely theoretically. But maintaining a connection needs to benefit the child. It needs to be safe for the child, emotionally and physically, and it needs to fit into the child's world. And sometimes I think the goal is to introduce birth family members to children in care. So sometimes children will be related by DNA to people they've never met, have no relationship with prior to entering care.
Yeah.
And then there's a push to create this contact, which is why I call it contact, because birth family time to me is about that immediate birth family, but sometimes it kind of seeps into, well, you've got this relation on this family tree and we're going to introduce you to create a relationship. And then we'll send the child along to this essential stranger, because maybe the agency needs a placement in a few months and it's a way of creating a connection and a relationship for a placement down the track. Or maybe the child just generally needs a bigger support network. But oftentimes birth or family members can be complete strangers, and we introduce them into this contact world.
And I think sometimes that's actually okay.
So do I.
Like, I think sometimes that is amazing casework. And I think that's actually something that's really important for this child. But I guess maybe if we take a step back and because you said it's about maybe they'll need a placement down the track. I think maybe it's around the purpose of the relationship.
Yes.
And the purpose of why you are introducing this new person to this child.
So you need to know the purpose of family contact.
Yeah.
And you need to know what is the goal. Is the goal to maintain a connection?
Yeah.
Is the goal for reunification? Is the goal for identity?
Yeah. Yeah.
What's the goal? Why are we doing this?
So we're really talking about decision making, aren't we? That's kind of where we've landed already in this discussion. What are the considerations around decision making in terms of who this child should have a relationship with, and what does that relationship need to look like?
Yes.
And the third point is, what is going to be the impact on the child, and who is going to assess that? Do you know what I mean?
Yep.
Because, you have some children who will have, changes in mood, changes in behavior leading up to a visit. And then you'll have some children who will have, and maybe they'll be the same children, who will have changes in mood and behaviors after a visit. And it's about trying to work out what is that about? Like, what is maybe driving some of those changes in mood and behavior? And I think sometimes that gets a little bit mislabeled.
Yes.
Because I think sometimes that might fit with an agenda, particularly if that change in mood or behavior is seen as it's because they miss them, so therefore they might need more contact. And maybe that is the case. But unless you actually are assessing this properly, how do you know?
How do you know?
Or it could be because they've had contact, so we need to reduce contact.
Yes. It can be so many things. But I think we often go to those two.
Yeah, those extremes.
Increasing it or decreasing it.
Whereas it could be that it's a grief and loss response that is perfectly normal. Perfectly normal. And it doesn't actually need to be pathologized any more than just knowing that might be what actually is causing these behaviors.
Yes.
That is causing these changes in emotional mood. And, if I was placed into a situation that I found really hard to emotionally, psychologically manage, I'm sure there'd be an impact on my mood and my behavior as well. Do you know what I mean?
Absolutely. There's an impact on my mood and behavior this morning because I forgot a school bag in my car. And that's a minor thing.
Yeah.
Like, this is your point earlier about how we use language and we minimize activities.
Yeah.
We also minimize the experience of children and young people in this system and the experience that we often allow other people to have when they're grieving a permanent loss versus ambiguous loss.
Yeah. Yeah, that's right. Absolutely. Absolutely. All right. Do you want to get back to, you've got a pillar of a quote.
Do I? Oh, I do. So I undertook a contact assessment semi-recently, and I was really confused when I was writing it what the international research said about family contact. So I did some reading and just love this quote because I think out of everything I read during that contact assessment, that I was writing, this was the most balanced quote I found, a balanced paper as well, but also it wasn't shying away from positive and negative effects. So this is from Collins and Connolly Wright, and it's a quote from 2022, and they say, despite an extensive body of international research on direct contact in permanent care, there is a lack of consensus on its relative merits and risks for children. A recent comprehensive review cautioned against applying a one-size-fits-all approach and called for quality evidence to inform policy and practice. It found that when contact works well, it can help children to resolve grief and loss, come to terms with their history, strengthen attachments to carers, and retain positive family relationships. When done poorly, contact can reignite trauma, undermine placement stability, lead to idolisation of birth parents, or at worst, allow covert abuse to occur.
Yeah, 100%. I think that quote kind of really sums up the considerations nicely. And I know that what this quote is saying is what the literature has been saying for a long time, that there are pros and there are cons, and it's about understanding what the possible pros and cons could be for this particular situation.
Yes, but there is, as we know, research that you will read, and it's about the lens and the value, I guess, of the people writing it, isn't it? And it's just pro and positive. And if you look at some policies that are made in child protection system, fits in that space. And then there are others that are, the lens is quite negative and that there is no benefit to the child. And then in the middle, there's this whole body that sits around holding the space for both. But I do like that there is no consensus on its relative merits or the risks for children. So we're not in agreement across the world about family contact.
No. And because I don't think there can be this general consensus, because it should be so individual.
It should, but oftentimes systems talk about it in such a black and white manner.
And I get that, because I think it's one of those things, I think, that is really tricky because it's grey, sorry. I was going to say it's not black and white, but it's easier just to say it's grey.
Yeah.
Do you know what I mean? And I think we've already talked about this a little bit, because you have to know so much to be able to interpret what the best way forward is for this particular situation that you're talking about. You have to have so much foundational knowledge.
And see, that's why it makes no sense to me that it's black and white, because nothing in the child protection system is black or white. And you have to have so much knowledge on so many things. So why is this so different?
I think it is different. I think it's different because you can't actually have a structured decision-making tool where you can actually go through and it guides you through a decision-making process in terms of this. Even though, is there one? There probably is one.
No, I don't know.
Well, I'm glad there's not. Because it needs to be so individual. And I think the fact that there isn't a guided decision-making tool actually says a lot.
But I don't think there should be a structured decision-making tool about risk or removal or restoration either. I think hand in hand with professional judgment, but that's why I don't get why the system struggles with family contact so much, because no assessment in that system is black and white. It's all nuanced.
Can I just say 200% I agree with you. I have a big...
Stop playing the other side.
No, because I also see that there needs to be some kind of operational consistency in terms of how decisions are made. I see that. I think that child protection is so great. I agree with you, but I think there have been some elements of the child protection out-of-home care system that have been made black and white to promote some consistency around decision making and some consistency in terms of expectations. So I'm a family member. This is, I've now got child protection involved. This is what I should be able to expect. Because what you can't have is cowboys going off running their own show, and we've seen that. So
I might have been one at some points in time.
No, but you would have actually done it for good reason. You would have been...
Well, I'm sure any cowboy, cowgirl would argue they've done it for good reason.
I don't think so.
Oh, I do.
Do you?
Yeah, I do.
I think some people would be, if there isn't like a clear black and white process around some things, not everything, but some things, in terms of those things, I think you'd have people that would go out of their way to make sure that they actually made considered decisions and used professional judgment and were really reflective. But you'd have some people, for whatever reason, who would not do that. They'd make the easy decision. They would do the least amount of work. And that could be because of burnout. That could be because they don't care. That could be for lots of different reasons.
Okay, I do agree.
I know you agree.
It just, kind of lights a fire in me, because I think the consistency should be in the best interest of the child.
I agree.
Every child is different. Every family system is different.
Yeah. Siblings
are different. The way siblings experience their family, their parents is different.
Yeah.
So therefore, they can't be consistent in that way. It needs to be who is this child?
Yeah.
What do they need? What is their felt safety?
Yeah.
How do we achieve that? How do we look at relational permanence, bring in attachment?
Yeah.
For me, I just think, and maybe I just simplify it too much, but I'm like, why we just get so hog-bogged in those expectations, and then it becomes a one-size-fits-all, and that's really the outcome that bothers me the most.
Well, I think it's because, and I mean, I don't mean this to sound so kind of willy-nilly. It's because it is, because of course it's a big problem. We know that. But I think the problem gets bigger when you don't actually invest in teaching people how to be reflective and how to actually have and respect their own professional judgment. I think when you have someone who joins a statutory organisation 3 months later, they're acting manager and they graduated 2 years ago, I think that's a problem, because how can that person actually have appropriate professional judgment and then teach that to caseworkers under them? And I think that's the world we're in. And I think internationally, that's the world we're in. I mean, of course, I'm, generalizing. And I'm sure it's not 3 months, I would hope. But if that's the world we're in, and you have people in a decision-making role who actually might be doing the best job they can do, but you can't possibly know if your own experience has been somewhat limited.
Yes.
And I don't care how amazing you are. I don't care how intelligent you are. I don't care how old you are. It's about that experience and that ability to learn from that experience.
Yes.
Should we talk about what are some of the considerations around decision making?
Mm-hmm.
And then should we talk about what are some of the skills and what is some of that important knowledge that supervisors should have?
Yeah.
What do you reckon?
Perfect.
Okay, so let's talk about considerations for decision making first. So I want you to put your old manager hat on.
Mm-hmm.
When you were making decisions around contact, what did you think about? What did you consider?
Who is this child?
Yep.
Who do they view as family, or who are their significant relationships?
Yep. So in terms of relational permanence, that was really important for you?
Yeah.
Yep.
Yes. And I think in general in life, it's really good to be able to maintain relationships.
Yeah.
It's good to have strong relationships.
Yeah.
But it's also good to have an eclectic mix of relationships. So not every relationship will look and feel the same way, and that is okay. So for some relationships, you don't need a great frequency of contact, or you can get by on sending some pictures and having a phone call and maybe some cards at birthday and Christmas. Not every relationship needs to look the same or feel the same, and therefore the way in which you have contact with those people can be very different. Sometimes direct, sometimes indirect, and sometimes a mix.
Yeah.
Some so frequent, and other relationships you actually don't need the frequency. So the first thing I think about when you ask me to put that hat on is, who is this child? Who are the people in their world? And what is the strength of the relationship? And some relationships may need to be strengthened. How do we figure out what those ones are so we can have a different, type of contact going on? What are the relationships that we are just in maintenance, and, it can look and fit this child's life? Because in amongst all of that, that child has to go to school, maybe has some talents outside of school where they're doing practice or music, and, they also need to socialise with peers.
Yeah.
So there's all of those considerations.
And I also think decision makers need to know what this child's history has been.
Yes.
What has been the child protection history? What has been the risk history? Who has made this child feel safe and who has not made this child feel safe? And then what have been the considerations on those important adults in terms of why or why not in terms of keeping this child safe.
Yes, and in terms of safety, I think it took me a long time in this line of work to think about those adults in children's lives who weren't necessarily a risk to the child, but also weren't protective, didn't raise concern, didn't acknowledge, didn't address, didn't let someone know that they were seeing the abuse. So whilst they themselves may not have been a risk, they were actually not protective. And then how does that child internalize that?
Yeah.
Because that is a huge consideration when you think about contact with oftentimes extended family members.
Yeah,
And I think we overlook it.
I think so. And it reminded me of some young people I've done life story work with before, who have said things like that about family members, have said things like, they knew what was going on, why didn't they help me? They knew, but they didn't tell anybody. Exactly what you're saying.
Yeah.
Because kids can see it as well.
Absolutely.
And kids know.
There are, as we know, many different reasons why adults don't or can't or won't invoke some protective action. And that doesn't mean the relationship is just, minimal, or we don't need to consider how this could be different. It means that we do need to consider. We need to, have those conversations with those family members around, this is the child's experience of you.
Yeah.
We should be investing in repairing relationships. So is there a way to repair this? Is there a way in which this can be explained in a very appropriate manner, dependent on the child's age, for what's happening? And it's not about justifying it or minimizing it, because if it is, then that to me tells me that relationship shouldn't be invested in. But if there can be some accountability and some repair work with that child and that adult, that should be invested in.
I agree. I definitely agree. So it sounds like what you're saying is that it's definitely about considering what is the purpose of the contact for the child. Should always be about the child.
Should always be about the child. And I laugh because the purpose of contact, I remember for years the purpose was either for identity or for restoration.
Yeah.
And that was very black and white. There was no in between.
Yeah. But we know that it's grey. We know that there's going to be some families where restoration is never going to be an option, and that's okay. That shouldn't be something that's like, oh, well, that's a sad thing, because sometimes that's the best thing.
Yes.
But then there's always going to be some families where restoration is definitely the best option for this child. And again, that is something that is great as well in terms of decision making. Again, I think this is a different topic, but we can't be applying this one size fits all to restoration considerations either.
No, definitely not.
No. But I do agree that was done very badly years ago. Like, restoration wasn't something it was just tokenistically considered. And I do agree that we need to consider that much more in depth now. But I don't agree with this one-size-fits-all thing where you have a child who's been in foster care for 10 years, but because there has never been this restoration consideration, suddenly the agency, whatever that agency is, has to go back and actually explore whether restoration is a viability.
Yeah.
I think that is just destabilising and just so utterly ridiculous.
Yes. When that practice was introduced, those were wild times. And I don't think that practice, as far as I know, exists now, because I think there was some work done on that. But I'm sure there's still pockets of that where, every year or 10 years on, we look at restoring a child to birth parents.
Or
because the legislation guides you some way to do that.
Or let's be real, because this child can't be placed anywhere else. So let's give them back.
Yeah.
No, I mean, and, they're 14 and they're causing a stir and nobody will care for them.
Yeah.
So instead of actually thinking about, okay, what is going on for this young person, let's just give them back. I mean, talk about setting people up for success.
Yes. What other considerations do you think there are for defining what family contact?
Do you mean in terms of decision making?
Yeah, decision making.
I think it's around managing expectations for the birth family, for the child, for the carer,
for the workers.
That
is such a big consideration.
Being on the same page around what is the purpose of these visits. How should they look? Why should they look like that? And then how are we going to make this so it's in Fred's best interests instead of maybe you parent or maybe you carer or maybe you grandma?
Yes. And then how do we understand Fred's actual experience and make sure that it's the right fit?
Which is where contact supervision comes in. If, I mean, that's another consideration actually, isn't it, around the need for contact supervision? Because certainly not every visit would need same level of contact supervision.
Well, yes, not every family system would need supervision.
No.
Or a particular way to have it supervised. Yeah.
But if it does need supervision, what should that look like? Which I think is part of the passion for us, isn't it? Around, being able to actually make decisions around what the supervision needs to look like.
Yeah.
In terms of other considerations, so we've talked about knowing the history, we've talked about knowing the child's experience, we've talked about the why contact is going to happen, we've talked about managing expectations.
Should it be supervised or not?
I think as far as possible, arrangements for contact should be collaborative. Why are you looking at me like that? I think agencies cannot make decisions in vacuums about children. I think you have to invite, surely, as a level of respect for a birth family, you have to invite them into the decision-making process.
Yep.
And it can't be tokenistic. You can't say, let's come in for a meeting and talk about contact. And while they're in there, you say, we've decided contact's going to be 6 times a year. Do you know what I mean? It can't be like that. It has to be collaborative.
Yeah. No.
But that also doesn't mean that you then, mum comes in and says, I want to see them every 2 weeks. And you go, that's a great idea. Do you know what I mean? It's about having this collaborative process.
Yes.
That's a true collaboration.
And I think, I laughed when you said it, because I do think you can have collaboration with very clear non-negotiables. And I think that is the part that we don't do well. Before we start deciding on how could this be, I think there needs to be very clearly written and discussed non-negotiables. For example, this child must be in school between these hours. That is a non-negotiable. We're not taking this child out of school for contact. And I'm not saying that's for every child. I'm saying that's an example of a non-negotiable. Or this child absolutely loves her violin lessons. And violin will change, but for this year, we know violin is on this day at this time. And non-negotiable is contact is not anywhere near her violin lessons. We need to come to collaboration, but with very, very clear non-negotiables that are articulated to everyone that's part of the collaboration. And I would even suggest written down on post-it notes in the middle of the table so everyone can continue to maintain a focus on this is non-negotiable, because the non-negotiables come from what's in the child's best interest and what meets their needs. That's how you center a child in collaborating around birth family time.
Yeah, I agree.
Or contact.
Do you remember that complex case review process where you actually drew a circle and you put the child in the middle? That was such a powerful visual for that very reason.
Yes.
The child was always at the center, and because it was like this huge big picture, you couldn't forget that.
No. Well, I would suggest now the picture of the child needs to be in the center with post-it notes around what is actually not negotiable, so everyone comes to collaborate on the same page.
Yeah, I'm with you 100%. Why doesn't that happen? Because doesn't that just make so much sense?
It does make sense. I don't know. I think we hear the word collaboration and we think that it's about give and take, and absolutely it is, but there has to be a framework. And you have to establish that. And part of that framework is what's non-negotiable.
Yeah, I agree with you. And I think it's that stuff around managing expectations is around being clear around the non-negotiables.
Yes.
And the reason why they're non-negotiables.
Yeah, you have to have that. Yeah.
But definitely. we know that that's not always the case.
No.
All right. I think we've covered decision-making considerations.
I can't think of any others. Obviously, the legislation.
Oh, yeah.
The policy of your organisation.
Yeah.
Probably been fiscally responsible, or the funding of it.
Yeah.
They are. Let's be real. They are considerations.
I tell you what shouldn't be consideration: an overly vocal carer or family member who demands contact, and so therefore it happens.
Oh, so you mean like the complaints unit saying, listen, we've had far too many complaints.
Yes.
Can you just give in?
This person will not stop emailing, and now they're CCing in everybody, and it's really making us look bad. Just give in.
And you don't think that should be
I just
how it
don't
works?
think that should be how it works.
Okay.
I know it's really, I don't know, naive of me,
Very nice.
but I just don't think that should be the way it works. And I think if you have a family member who is demanding contact and they are unable to understand the child's perspective,
Or unwilling.
unable or unwilling, then I think that should tell you a lot about contact planning.
So agree with you. And possible impacts on the child.
Yeah. Yep. I
Yeah.
agree. And I think the other thing that shouldn't be a consideration is when you over attribute skill to a parent or a family member.
That's really tricky, that one. In how do you know that you've over attributed capacity and skill?
I guess you as the person doing it, and we've all done it. Absolutely. I'm talking about myself as well. I've done this. But you as the person doing it, you don't always know. But I guess that's where good supervision, that's where reflective casework, that's where sharing, collaborating and kind of inviting people in to decisions is useful.
Yes.
Do you know when you've got a birth parent that's been cleaned for 2 weeks and therefore unsupervised overnight contact should definitely happen because they've tried so hard, Rose?
Yeah.
Do you know what I mean?
Yeah.
Like, it's just really silly. But because this person's really nice to you, they've never yelled at you, they're trying really hard, they might cry on occasion, suddenly they're doing their best. And they might be doing their best, but that doesn't mean that this child is a guinea pig.
No, and it doesn't equate to increasing contact, changing maybe from supervision to non-supervision, extending the time, the frequency, all that. I agree.
Yeah.
Yeah.
I feel really like I'm being really kind of, I don't know, a little rude about this.
Yeah, I was going to say a little assholey.
I am being a little assholey, aren't I?
I think we both are.
I don't mean to be, but then I find maybe I do mean to be. I don't know. I just want to be really clear that I am not an expert in this. Like, I've made my own mistakes when I've been in that decision-making process or decision-making role.
Yes.
So it's very easy to sit outside of that and be all like, there.
Well, I think we all have, but I think this is where that knowledge component comes in, right?
Yeah.
Knowing Eileen Munro's common mistakes in child protection practice.
Yeah.
Having a good supervisor, having the ability to reflect, having the ability to invite others in to collaborate with you.
Yeah.
It's those skills that help you grow and learn from practice. And if we're doing that, that's really all we can ask for. But we know that for a long time, certain people sit in, and certain agencies, I know an agency who had a blanket policy that the program goal was adoption, therefore contact was 4 times a year, full stop, the end, no more, no less. It wasn't even negotiated. Like, we have sat in spaces where we've seen some pretty ridiculous one-size-fits-all policies or processes.
That's true.
And that's why I think we sit here with this level of cynicism, because we also, on the flip side, work with a lot of children and young people that have come out of the care and protection system, and contact continued to be abusive, and it continued to be unsafe, and it continued to undermine their sense of self and their identity. And now as adults, they're still trauma processing and trying to figure out identities, and a large component of it was because of the harm done in contact.
Yeah. It's like you take this child from this home environment that is unsafe for them emotionally, psychologically, sexually, whatever, and then you place them back into this very unsafe environment because it is family time.
Yes.
And because it's in the office, and therefore, of course, it's safe, without understanding all of that kind of undercurrent psychological stuff that happens.
Yes. I see it like as we remove a child from this system, but then when it's unsafe, we go back and we immerse them and we submerge them in it, and then we take them back, and then we put them back, and then we take them back. But it's only for an hour a month, so it's okay, or it's only fortnightly, or there's another adult there. So that submersion back into that family system where there's been no change, there's been no recognition of the child protection concerns or risks. There's been no repair work, but it's a limited time, so it's like less damaging.
And on top of that, we're going to send a stranger every time this child...
A
different stranger every time this child sees this person. Or we're going to try our best to have the same person, but if it doesn't, and so sometimes they might be the same person, but still they're a stranger.
Yes.
We know about attachment. We know how often, or not how often, but how long it takes a child to trust somebody new. So just because they've met this contact supervisor twice doesn't mean they're going to trust them to keep them safe.
Yeah.
All right, I'm going to try and stop being so assholey. That was a good way to put that.
So eloquent, Anna.
I don't know if it'll happen, but I'm going to try.
Give it a whirl.
I'll give it a whirl. All right, let's talk about the purpose of supervised contact. So, if a decision has been made that supervised contact needs to happen, what's the purpose of that? I don't know. Maybe we've covered it.
Well, you said that and I paused because I was like, to gather evidence. If we're in the court process.
Yeah, that's
sometimes true. I think that's the purpose.
That's true.
Gathering evidence.
Yeah.
Or we're informing decision making.
Yeah. I mean, that's probably a better way to put it. But gathering evidence is, I guess,
sometimes
real.
I think that's the purpose. And that becomes opaque. And maybe it should be opaque. I don't know, but maybe it should be clarified.
But think about when we do parenting capacity assessments. I mean, really, we are interrogating evidence when we supervise contact. Not even supervise, more observe contact as part of a parenting capacity assessment. But you are also using that information to inform decision making.
Yes.
So there's like two kind of parallel processes going on there.
But I feel like that's clear to the people being assessed.
Yeah, maybe. That's true.
Because I think...
That's true.
I've heard you explain why you're coming to observe contact.
Oh, have I done it okay?
Yeah.
Thank you.
That's why I think it's clear.
Okay. Thank you.
But I guess other reasons why a contact needs to be supervised is it's actually not safe for the child.
Yeah.
The person that they're going to see is not a safe adult.
Yeah.
And that can be emotionally or physically or sexually.
Yeah, absolutely. And I guess the purpose of having it supervised is to try and promote as much safety as possible.
I think that's really hard. How do you promote emotional safety?
No.
With a stranger supervising.
It's absolutely the $200 million question, isn't it? How do you promote emotionally psychological safety when you are being, and I love the way that you kind of described that, being kind of submerged back into this situation, this risk situation, when you are like this kid and you're kind of drowning in this situation. How do you then look at this person who might also be sitting in the room and thinking, it's okay, they're my anchor. They're my lifeboat, I'll be okay. When they don't know this person.
Yes. And I think when you go back to what we were saying about the considerations that inform what contact's going to look like.
Yeah.
I think back on the times where I've said absolutely no contact with this birth parent for this child, and oftentimes that ended in numerous days of a hearing and evidence being, rightly tested, that there are times where you actually can't figure out a way that the child will be emotionally safe or physically safe. And to me, that means no contact. It's not about dancing and bending and molding and becoming this magician to make something better than nothing. It's actually sometimes contact can't happen and shouldn't happen.
I have said, in one particular situation, I have said no face-to-face contact, but if, depending on the child's wishes, they could write a letter. It doesn't mean that they will respond to a letter if the parent writes back. So I've kind of written some recommendations where I've said absolutely no contact because of the psychological harm that this will do. But it has to be then, we need to be forward planning, say 5 years' time, when this child is now adolescent and maybe they want to reach out.
Yes.
So it should be something that is allowed. It should be something that's encouraged.
Yes. And I think those instances with those recommendations and the 2 times where I've said absolutely no contact. They are so rare, but there are occasions that birth parents are so abusive and so risky to children that contact either needs to be like that or not at all. But then the scaffolding around that child needs to be something like therapeutic life story work, so they can understand the family story, they can understand the history and the decision-making process, because we know then the risk is that we fantasize then what that parent may look like.
And
I agree. It's not okay not to have a scaffolding then for the child to understand, you know, the history and the decision-making process and the concerns.
Absolutely. And it's something that should be revisited.
Yes.
Like in that situation, this child was an amazing, amazing placement with a really lovely, caring family. And this child identified in that family.
I think I know who you're talking about.
Yeah, you do.
Yeah.
They didn't identify with the birth family at all, because that birth family had always caused them harm.
And significant harm.
Significant harm, that's right. And so they always identified with their foster family, who I think is now like adoptive family, actually. And lovely, lovely, lovely place for this kid to be. And they also went through a process of life story work, and they also kind of went through a process of therapy a few years after the life story work, so that the the situation was always being reassessed with the child.
Yes. In reassessed in where are they sitting with it, how they're feeling about it, what are their wishes now, because they've grown and developed. And sometimes, children or young people will lead what they want it to look like, and after that process is often really good.
Yeah.
But when there's no process and then we listen to children or young people's wishes around contact and it seems easy, that's where sometimes I think we get ourselves into strife.
I think we do. I definitely think we do. And I think this might be a little bit of a sideline issue, but I think sometimes when we're making decisions about contact and there's this view that it has to be this meaningful interaction for the whole time, and I think that view is problematic, because sometimes just being with somebody is actually enough and is all that the child can tolerate. So doing an activity...
I'm laughing because I remember listening to you say to someone on the phone, well, contact could be at McDonald's. And then I saw your face and you were like... And I was like, well, that's interesting.
My face was like that?
Yeah, because I think their reaction must have been like, we're not doing contact at McDonald's.
Yes. I say that a lot, because... not for everybody, but where the purpose of contact is about being with. Have it at McDonald's, have it at bowling, have it at the movies. Do you know what I mean?
Yeah.
Have it somewhere where this child can be with this person, but it's safe for them emotionally and physically, and there doesn't have to be interaction. Works particularly well for siblings as well, particularly when there's been a sibling disruption.
Yeah.
I've also said for siblings, have it online. Let them watch the same movie together and then have them like on Zoom so they can
same time.
talk about it. That is great for some siblings.
Yes. Or play a game online together.
Play a game online.
Yeah.
Doesn't have to be this, I'm staring at you, you're staring at me, because we're going to have meaningful
And there's a weird lady in the corner with a clipboard or a mobile phone furiously typing notes.
Yeah. That's right.
Yeah. Sometimes I've been that weird lady, but it's weird. It's not. Yeah.
Same. Yeah. Sorry. I think that was off topic a little bit, but it just popped in my head and I knew I'd forget. All right. So
do we want to talk about the skills of a supervisor?
Yeah, we do.
Because I think if you're going to make a decision that family contact needs to be supervised, then we need to think about what are the skills we're hoping that supervisor brings.
Yeah.
Because if you're supervising family contact, it means to me either there's a risk that the child will be unsafe physically or emotionally.
Yeah.
That the family members may need some assistance in relationship repair.
Yeah.
Or just have assistance with their skills to manage the child and to form a relationship.
Do you think the contact supervisor should be a passive person in the contact?
Look, I have to tell you this. I always had an assumption that contact supervisors were not passive. I thought that their role was so clearly defined that they were there kind of almost as a child advocate and as a bridge to help whoever's in that situation to maintain safety for the child, but also to help with skills, with relationships, with suggestions, with kind of directing if things are going a bit awry and making it palatable, because it's supervised contact, right? So we're talking the upper end of cases here.
Yeah.
I did a contact assessment a few years ago, so went in to observe, and there were 2 supervisors in this contact. This is how interesting this was. 2 contact supervisors had been for 12 months.
The same people?
The same agency. There was an attempt to try and have some level of consistency. And then I was like, well, I'm coming to observe. We don't need to, like that. To me, I was like, I can't do that. I can step in and take part of the role of one of the supervisors. What's the role? Crickets.
Oh.
Like, what's your expectations of me? Because I really don't want there to be 3 people now.
Mm-hmm.
Can I step in? What would be your expectation of me? Yes, I'm observing, but what are the boundaries I need to be aware of? What are your expectations of me? Oh no, just having you there is enough. Oh, that's a bit weird. So I observed/supervised this contact with another contact supervisor. It was a 2-hour contact. The entire time that contact supervisor sat on a lounge taking notes on their phone. And I was like, the contact, it was a disaster. Like I was thinking, why did I say I'd do this? Because I can't last 2 hours. I needed to get out of that room. No assistance to the young person or the family. So after it ended, I asked what their role was, and they said to sit and take notes. I almost fell down, Jodie. I was like, sorry, that's always been our role. We don't intervene. Has to be extreme for us to intervene. Our job is just to observe and take notes. That is not how I had, and this was a contact agency that I had previously sent lots of referrals to with a different assumption. So I don't have a clear knowledge or expectation of what contact supervisors that I've used are meant to be doing. What's your idea?
Again, I think it should be an individually planned thing. I think for some, and it really depends on, I think, the purpose of the visit. So I think if it's a restoration, then I think there needs to be interaction between the contact supervisor and the parent, because it should be around role modeling. So therefore you need a contact supervisor who actually, in terms of skills, who actually has parenting skills, who actually understands parenting, who maybe has lots of information and knowledge about attachment, about child development, about how to promote appropriate developmental opportunities for children. Yeah.
Yep.
Versus if it's, a contact that is 2 hours 4 times a year, and it is about, you've got an adolescent and you've got a parent, and this contact worker can then maybe take a more passive role. But I would always expect them to be still a part of the interaction. Do you know what I mean?
I do. And I think you said it should be individualized, and there should be some form of communication to outlay expectations right at the beginning. And I kind of sit here and think it's so obvious, but I think back to all the years of making referrals or saying to caseworkers or managers casework, after careful consideration with you all, I do agree this actually needs to be supervised. Get an agency. I don't think I can tell you, and every single one of them we sat down and said, here are our concerns, here are our expectations of your contact supervisors. Can we match even? What skills have you got in your workforce, and how do we do that? And it seems ridiculous now that I sit here and say it out loud, but I don't think that happened very often. In extreme cases, yes, but if we're having contact supervised, it's extreme.
Yeah, I agree with you. Because I think there was this assumption that, they know what they're doing.
Yeah, well, years later, when I got this contact assessment and got it because it was problematic, I mean, you've got two supervisors in a room with a young person and one of their parents. That's pretty extreme. My shock that their role was just to sit and take notes. Why do you need two people to do that if that's what your purpose is?
Yeah, it's a bit weird.
Isn't it?
Why did they need two people to do that?
I just think the contact was so emotionally unsafe for that young person.
Yeah.
But no one had actually said this is what we need from the agency. And things like that family system had its own kind of language. And over time, a particular caseworker had understood the language, but none of that was shared. So that secret language was still occurring in the contacts.
So what, they just add more people in?
Yeah. Instead, yeah. It was really, I mean, it was a very problematic contact, absolutely. But to have two adult supervisors in there, but both are just taking notes, blew my mind. I was shocked.
I mean, I don't know why you're so shocked. Why are you so shocked? Right. You explained why you were so shocked. So we don't have to go back there. But yeah, I don't know. Normally I'm the little Pollyanna one. I'm like, oh my goodness, truth, blah, blah, blah. But in this situation, I feel like I'm like... You're
looking at me like I got 10 heads?
No, never. But I'm kind of like, I don't understand why you didn't think of this. Why? I
don't know. And when you talk about the skills that a contact supervisor should have, absolutely, if it's restoration, they should have some parenting skills, some knowledge of attachment and how to promote attachment.
They absolutely. I mean, they definitely should have some skills around child protection dynamics.
Seems obvious, but they shouldn't they?
Yeah, they should. There needs to be some understanding around what grooming means. There needs to be some understanding around cause and effect in terms of conversations. But I was thinking about that shared language stuff.
Yes.
Happens all the time, doesn't it?
Absolutely.
And that parent or that carer or whoever it is only needs to say one particular word. And so you need a contact supervisor that's able to actually see that dynamic in action and know what it is that they're looking at. Because I think, and I know, I mean, I've written training for agencies around contact, and one of the things I talked about was you need to know what you're looking at any given time when you're looking at it.
Yes.
And then you need to know how to respond.
I would think as a contact supervisor, done well with skills, you would be exhausted after every contact.
Because I think it's hard. It's hard work.
Yes.
I think hats off to those people that go in and are able to have really good rapport skills, able to actually talk and kind of facilitate this interaction with strangers usually. Even if you're the same person week in, week out, you're still a contact supervisor. You're still on that kind of side of the fence.
Yes.
You can't be aligned with the parent in any way. So you need to have someone who has good rapport skills, someone who has good child development, child protection skills.
Yes.
Someone who can respond in the moment so they're able to reflect in the moment.
Someone who is in control of their own kind of emotional state.
Yeah.
And I think also someone who is aware enough to know that they only know the tip of the iceberg.
Yeah.
Because very rarely in my experience do contact supervisors get a detailed or even a summary of the child protection dynamics.
Which is such a worry.
And when you think about grooming behaviours, you think about how people can present on any given day, it can look good. But when you don't understand the child protection history, I think sometimes as a contact supervisor, that'd be a tricky space to be in, so that knowledge that you're always only getting the tip of the iceberg and so much sits beneath that you may never know or never see. But that's kind of very dangerous if you ignore that and you just on face value thinking, this is a lovely contact. Because I've read so many reports like that and I think, oh, sorry?
Yeah, same. My issue, when I'm being a little bit cynical, is never about the individual worker, never about the individual contact worker, because I think they are just doing what they're being told they need to do.
Been asked of them, yes.
My issue is always with the way that person actually is supported. The knowledge that they're given to be able to do their job properly, the supervision they themselves are getting, and then the information that comes down
from the referring agency.
That's always my issue.
Yeah.
You can't actually expect people to do an amazing job when they're either not supported correctly, they're not given the tools that they need, or they're not given the information.
Yeah, I
Like,
agree.
it's just ridiculous. And then there's this whole issue around, well, they're just going there and having fun. Okay, well, that's actually because that's all they can do.
But also, are they?
Yeah.
Come on.
Yeah, that's right. Wouldn't be my idea of the fun.
No.
Yeah. So
any other skills?
Well, I just want to say, when you're hearing my cynical voice, it's never about the individual worker, because I think they are doing the best job they can do.
It's the system they work in and the support they receive.
Yeah.
Yeah.
It's always about that for me, because don't set people up to fail. Most of all, don't set children up to fail.
Yes.
And if you're funding this whole process and it's not cheap to fund supervised contact, then why would you want to fund it so that it actually is detrimental to the parties? I don't understand that. I don't understand that at all.
I don't either.
Anyway, that's my high horse moment. Did you enjoy it?
I always do.
I get on my high horse. It just makes me so angry, as people who listen to me know. Like, I just think, I never ever want to blame individual people for the work that they do, because I always, unless they've got all of the skills and the tools and the information, they still choose to do a shit job, different. But usually that's not the case.
I was going to say, that'd be so rare.
Yeah.
Because I think, go back to what we said originally.
Yeah.
Well, this system that we're in has made it sound like this rainbows and lollipops and not a very important decision to have contact. And it's, become something that should be, that's viewed as a lovely event.
Yeah.
And so the whole thinking and framework around it has been eroded. So
yeah, it's been minimized.
Yeah.
The actual activity has been minimized, and the language used has made it into something it actually isn't. And can't be, even if it's the most amazing contact in the world. Even if everyone has the right expectations about what this is actually about, child comes, they have this lovely relationship with a family member, that child is still going to be left with feelings, and that child is still going to be left with dealing with grief and loss.
Yes.
Always. And that has to actually be something that is understood, not pathologized, because it's actually okay.
Yeah.
It's okay. It might be really hard in the moment for everyone involved, but it's okay to have a feeling about it.
Or feelings.
That's right.
Yes.
Doesn't mean we have to rush to make some ridiculous action or decision because somebody is upset because the child was having feelings. Anyway, that's my other high horse. I'm going to get off my high horse now.
All right, come down. Where are you climbing off your horse to go?
All right, I don't know. All right, other skills. There needs to be really good documentation skills.
So when you say that, do you think that includes analysing what they've seen or just documenting what they have observed?
I think just documenting factually what they have observed, because I think that unless there has been a critical incident and unless they've had to kind of react to something that is out of the ordinary, that is different, because then they have to put rationale as to why that was out of the ordinary and why they had to react. But I think otherwise, I think it just needs to be factual, not emotive.
I agree. Things like, the child was so happy to come to contact today. How do you know that? Can you not write, Jodie came to contact today and was observed to be smiling a lot and provided Rose with numerous hugs at the beginning of the contact?
Yeah, just write that.
Write that. Don't write that, Jodie was so happy to come to contact today.
Yeah.
So you actually don't know that those smiles and that hugs are a happiness.
And you're automatically flavouring the whole report. Automatically.
Yeah.
Yeah.
I agree. I think observational facts is what needs to be documented.
Yeah. So knowing how to do that is critical. Critical. For all those reasons we talked about before, because we know contact is about gathering information, we know that lots of decisions get made based on the reports.
Yes. And we also know that children that are having supervised contact are having it because they have been abused and neglected and removed from their family system, and you are submerging them back into a system for a period of time after they've been out of that system.
That's true. That's true. So, yeah. So in addition to everything else we've talked about, I really need to know how to actually write a report that is concise, that is clear, that is non-emotive.
Yes, factual.
Yeah, not biased.
And that's hard because we all bring our values to work. We bring our biases to work. And you said earlier they need to have good supervision. This is where supervision can help them, maintain factual documentation.
Yeah, that's right. Yeah. So there has to be some quality checking of those reports, doesn't there?
Yes.
Yeah, I agree. In terms of other skills, I think we've talked about the knowledge, haven't we?
We have.
I think they need to have good conflict resolution skills.
Oh, yes, they do.
And good negotiation skills.
And like, it is really important. Oftentimes, in my experience, birth family will come to the contact and just want to have a bitch or a whinge or a debrief with the supervisor about the agency or the caseworker.
Yeah.
And whether it's people pleasing or appeasement or just a general conflict avoidant attitude, I've seen where contact supervisors and other professionals, they fall into the trap of going along with that whinge and agreeing either consciously or unconsciously. And then there's a dynamic that can create from that.
Yeah.
And then there can be a drama triangle that comes from that. And that is no good space to be in as a contact supervisor because you need to be neutral.
You do need to be neutral.
And that's a pretty hard skill.
Well, actually, I don't think you need to be neutral. I think you need to be an advocate for the child.
Yeah. So, neutral to the agency, I should say, and neutral to the the proceedings or whatever, the casework. Yes, but absolutely you need to be, number one, an advocate for the child.
Yes, and I think there has to be, and this might not be a skill in terms of more an agency consideration, I think there needs to be the opportunity for the child to actually form a relationship with this person before contact, which means that there can't be this every time that it's a stranger. But also there needs to be a focus on that. So we have to pay for this child to actually get to know this person who they are then going to put their trust in to keep them safe.
Yes, because if you think about emotional safety, how does a child create safety for themselves in a contact situation if it's emotionally unsafe with a stranger?
But even if you think about emotional first aid, informal support actually is the first port of call for emotional first aid. You can't have informal support between a child and a contact supervisor if they do not know them.
And it's a different person every week, cycling in, cycling out.
That's right. It's a lot, isn't it?
I guess it is a lot, and that's why it's so important that we talk about it, and why it's so important that supervisors have skills, feel supported, have adequate supervision, get proper referrals.
And get paid appropriately. And actually because if you paid contact supervisors appropriately, and then you're actually going to attract people who are actually trained and have appropriate qualifications to do this job. This should not be seen as the add-on that we can get anyone to do.
Yes. The adult with the working with children check.
That's right. This should be seen as something that's an important, integral part of casework support for this child.
Yes, and creating or maintaining safety for a child in their family system.
Yeah.
And it's a vehicle to, embed or create relational permanence, which is so important for young people transitioning to adulthood. So that's why the investment is also worthwhile.
But also, you said before, it's an opportunity for relationship repair. So one of the skills this contact supervisor has to have is the ability to promote relationship repair between other parties. So they actually firstly need to know what that is. They need to have the theory base that tells them what that is. And then they need to have the skills to be able to do it in action.
Yes. They also need really sound interpersonal skills too.
Yeah.
Yeah. It's a lot when you actually think about it.
Well, it's a lot, and it's a lot when you think about people who are put in this role who may have started TAFE or uni 2 days prior and suddenly they're a contact supervisor, but it's okay because they're on the pathway to getting qualifications. Maybe have never hung out with a kid before, might be really personable and a really nice person, but have never actually worked with families with such strong child protection dynamics.
Yeah. I'm laughing because that was me 20 whatever years ago. Was enrolled in a university degree as a youth worker and could be a senior youth worker in a detention centre. It's hilarious to think about now.
It is.
No, I had no skills.
No
theory.
But it's kind of what
But I was enrolled in uni.
Yeah, that's what happens.
Yep.
It's what happens. Think about it. You've got people who are doing supervised contact in that situation. You've got people who are doing support work. It's all the positions that aren't paid appropriately for what actually the job involves.
Yes.
Don't you think?
I do. And I've not thought about it from that lens before, but I'm glad you've raised it.
Always.
Because it is so true.
I'm always about highlighting how agencies and systems have let people down. It's my superpower.
Well, I'm not, that whole money budget thing, it's a whole different kettle of fish that we do not want to get into because we do not have the time. But you are right. If you are going to poorly fund contact supervisors, you're potentially not going to get the most qualified or suitable candidates doing it.
I mean, it's just so silly because you're then going back to your analogy of submerging this child. How is this kid ever going to actually be able to process trauma when they have to still themselves for being put back in that situation constantly without someone having the skills to be able to help them to process what that was like after the event on the drive home or whatever?
And that is why when we talk and think about recovery from trauma, I think in situations, and it's not all, but where the contact isn't safe, I can't be talking about recovery from trauma because they're still actively being traumatized in the care system at contact.
100%. And then the expectation is that they'll just sail through, they'll have this lovely visit, they'll leave. What's the profit?
They'll have a 3-week reprieve, and then it only lasts for a day or two, the behaviours.
Yeah, but then how about these kids where, they'll come back, they're so internally hypervigilant and so focused, particularly children that are more cognitive than emotional. They are so focused on keeping themselves together that maybe things are actually okay the day they get the day of contact, maybe even the next day. But then 3 days later, something minor will trigger this huge explosion. And everyone's like, oh my God, what's going on? We need to rush them off to get a diagnosis.
Yeah.
Do you know what I mean?
I do.
Gee, it makes me cranky. You can tell.
I do.
Yeah.
So I think what we haven't talked about is where does supervised contact happen?
Yeah.
That is dependent upon the child.
Yeah.
What's safe and appropriate and manageable for them.
Yeah. Do you know, I was once in this meeting and I can't even give you any context because I don't really remember, because you know what I'm like in meetings. I tend to, But I remember it was with like all these big wigs. So it was like big people. People who thought that it's one of those meetings where everyone spends at least 5 minutes talking themselves up at the beginning in the introductions. One of those meetings. God, I hate those meetings. And this person, I don't know who they were now because I can't remember. I think it was online and my mouth would have just been like dropped at what they were saying, who was sitting there just kind of talking up the fact that how terrible it was that birth family contact, family time they called it, family time happens in an office, and how inappropriate that was, and that no child should ever have family time in an office because it is so artificial and because it does not replicate real life in any way. So it should never happen, and on their watch they will never allow their workers to have family time in an office.
Tell me your response to that.
My response, I probably said nothing because I was probably so pissed off at that stage that I could not say anything. I wouldn't have said anything in that meeting.
So tell me now your response.
My response is what it should be. How stupid is that person? And this is a person that clearly was some kind of high manager in whatever organization they were in.
Of course.
Because it was all about, my staff and my teams and my this and my that. Do you know what I mean? And how stupid that person is and how dangerous her decision-making must be for the people that she manages.
Yes.
Because that is just not okay.
I mean, family contact is artificial. There is nothing natural or organic about being in the care system.
No, I agree.
Nothing about the minister being your actual legal parent is organic.
No.
Or normal or healthy.
Yeah.
So saying that it's so artificial to have it in an office, it's just...
It's mind-blowingly stupid, isn't it?
Just don't even.
No. And the amount of people that sat around this room like nodding, yes. And by that stage, that's why I wouldn't have said anything, because I was just out. Because I was like, I'm not involving myself in this. This is so stupid. And you got to know when you're going to influence and when you're just going to sound like
an angry,
low, crazy person.
An angry asshole.
That's right. So that's a skill that I've had to learn when to butt in and when to not.
It's a good skill to have.
Well,
I don't think I've mastered that yet.
No, you haven't. No, you're much better than you used to be.
Much better, but still not where I need to be.
No, but I love that about you. I love it. I love it when we're in a joint meeting and somebody says something so silly and you'd be like,
just need to channel you in the future and say nothing. I try. I am trying. I'm trying to master that. I am, everyone. I'm trying to.
Yeah, it used to be so much worse.
I was 1,000 times worse. Funny now, but probably not at the time.
No. But I mean, I always agree with you. It's very rare that I wouldn't agree with you. So,
whenever provides entertainment,
you
let's
do.
be honest.
That's true. You do. All right, I think we've said it all.
Well, let's hope we've said and got the message through that supervised contact isn't and should never be a one-size-fits-all or a box to check. It's dynamic. It's a living part of a child's life, and we need to really significantly invest in high-quality professional supervision and have good decision-making skills because we're not just watching a family, we're protecting a child's actual whole self and their future self. Why they try to navigate some of the hardest, most challenging, emotionally turbulent moments of their life.
Yeah. Well said, Rose. Well said. That was a good sum up.
Cool.
Yeah. All right. Let's finish.
Well, we're done. We're at the end of another episode of Relational Practice, a social work podcast. We hope today's discussion was valuable for you and your practice. And what have you got written here? We're going to explore ambiguous loss with a special guest.
Oh no! Don't say that.
Oh, stop.
No. That was. I just forgot to change that.
It's like you ever told me something.
No. Where'd you get up to?
Valuable for your practice. We hope today's discussion was valuable for your practice. We really hope you would tune in next fortnight and share our podcast with your friends, your colleagues.
Continue to send us emails around things that you find in your practice that you'd like us to talk about or you'd like to join us in a conversation.
Yeah.
We do have some special guests coming up.
We do.
We're planning this year to have some people join us. Not a lot, but a few.
A few.
Yeah, a few. So if you want to join us, let us
know. And Rosalind, we hope that this episode highlighted what your email intended to and that we did this conversation a bit of justice. Have a great week, everyone, and we hope to see you next time. Until then, stay safe and remember to always practice relationally.
But maybe someday